Hi and welcome back. Today I have a very fun video for you. In today's video, we are talking to Dr. Julia T. Hunter, a Los Angeles-based dermatologist. Dr. Hunter's philosophy is to treat the body as a whole by optimizing internal and external health to treat the cause, not just the symptom. Now, I have so many questions for Dr. Hunter, and I have really been looking forward to this video. So I do hope that today's video will be one in many her and I get to make together. But for this particular video, we will be focusing on aging, estrogen depleted, or menopausal skin. Dr. Hunter, I am so happy you're here with us. Thank you so much for being here.
My pleasure.
Now, Dr. Hunter, I said in the intro that I hope that this conversation will be one of many, because I have stalked you on the internet, and I know your extensive knowledge of not just skin, but the whole body. And I would love to create a network of doctors that can help women, because I get emails from women almost daily telling me that they're suffering with the hormones. So I hope that you will be back.
And I'm always joyful to do that, because look, we like you are inundated with people who are not getting the help, the direction, the medical guidance, the science-based medical guidance. And so hormones are an imperative, important piece of the puzzle. Yeah. And so I've always said that everybody who's on the same journey as far as trying to cure people rather than just treat their symptoms forever, you know, not looking at the surface, but why do you have things? Now, you can't cure hormones that are going down as we go down the path of life, but you can replace them in a way that absolutely not only slows down externally aging, keeps you healthier, keeps your brain snappier. Everything's better with hormones for men and for women. Mm-hmm. And as far as your skin, look, if your hormones are zero, and I see this a lot, no matter what I do, I can put the world's strongest skin products on your skin. I can do the best technology procedure or all the different things that we do as an action plan, a methodical, bespoke action plan for patients. But if the hormones are low, they're not going to get as good a result and as long-lasting a result. Although some patients genetically make hormones for a lot longer than other people. And Americans generally go into menopause earlier because they're so stressed out, etc. Whereas you see the Europeans, the Brits, they basically generally will continue to have a period for longer, better for the skin. You don't lose the fat in the deep dermis, so it helps with the anti-aging. But that's why replacement is imperative as well. So yes, everybody, all the practitioners who are on the same pathway of trying to help people, we should all know each other.
Tell us really briefly, how does a lack of hormones affect, I know firsthand how it affects the body, but how does it affect our skin?
Look, with skin, as your hormones go downhill, as we go down the path of life, as I call it, in men and in women, first of all, skin gets drier. It doesn't have as much hyaluronic. It doesn't have as much estradiol, DHEA, testosterone. So it gets drier. The rate, the metabolic rate, the physiological rate of producing collagen, elastin, all the skin components, which include hyaluronic, those decrease significantly, okay? And so you see aging, the skin thins. The other thing is this, aging is not just about the skin thinning. The bones are thinning, the teeth are thinning, the gums are thinning. So when people get these lines and they start to get jowls, it's first and foremost, a lot of times because they've shown the lateral cheekbones are what thin first. So this is holding up as it projects. It's holding the skin up. So these thin along the side of your ear thins, just the fat, because gravity is working on this every millisecond of every day. And so this starts to thin. It gets tired. It's holding up the world, basically. Okay, it's holding up your face to a certain extent. So the teeth thinning, there's a reason that I'm also obsessed with dental health, because that's very important for health and for skin in a variety of ways, whether it be brown spots, acne, enlarged pores, So your teeth really matter. But the teeth thinning are part of what make the lips sort of fall and go under, where people say my lips are thinning. Okay. So look, hormones keep your brain functioning at a youthful level. Hormones keep your bones making new bones at a more youthful level. Hormones help plump up. Deep in the dermis of your skin is a fat layer. That fat layer, you hear women talk about, oh, my skin, all the fat has gone from my face to my hips, my butt, my thighs, whatever. Okay. And you certainly, as a personal trainer, look, you're busy trying to burn that fat with exercises in the area. The other thing is with you, and this is a very imperative thing, is keeping your bones well mineralized with resistance exercise. It really matters. But hormones, testosterone, DHEA, people a lot of times don't talk about that. They don't talk about growth hormone. We don't have to give people growth hormone anymore. But what we do is, because the body can produce growth hormone until you die, but it loses the chemical messenger that makes the liver produce it from the hypothalamus and the pituitary, which are hormone producing glands deep in your brain. So we can give people what's called growth hormone releasing hormone that makes your body keep making the growth hormone, which helps with inner peace, with your bones, with your immune system. So in the vein of why do I do holistic, WHOL dermatology, is if you're not dealing with the inside, the outside not only suffers and ages and you start to see brown spots, wrinkles, fine lines, etc. You've got to deal with the inside in order to be the most successful on the outside as well. So hormones keep your skin plumped up. Look, people get vaginal dryness. You put the same thing on the skin as you put in the vagina to plump it up, to lubricate it. You put these things on your skin, it plumps up the skin. So hormones, the different hormones, okay? So it's not just estradiol and progesterone. It's estriol, it's estradiol, it's progesterone, it's DHEA, it's testosterone, and it's growth hormone, and thyroid. Thyroid is the gas for the car, another imperative hormone for keeping your brain functioning, your bones, your immune system, your skin, making new skin, new collagen. So that's sort of a long answer about why I care about hormones. And then the other thing with hormones, and this is one of the big problems in the world, is look, you want to mimic nature when you replace hormones. You want to give people the levels that keep them asymptomatic. They don't have night sweats or day sweats. They're not anxiety ridden. They can sleep, etc. So you want to replace those, but you can't overdose people, because if you give them too much, they'll gain a little weight. They'll be a little swollen. So you really do have to bespoke people's hormone levels. Perfect example, I had a patient the other day whose progesterone looks to be 0, but when you give this patient progesterone, they have symptoms of overdose. So again, what keeps us or should keep us humble in medicine is there's a lot we do know, there's a lot we don't know. And the body will tell you, and the physician has to be conscious to listen to what the patient says about, if I do this, here's what happens. It's a conversation always, particularly with your hormone doctor.
Yes. Wow. There's a lot to unpack here. That was some amazing information. But so let me backtrack just a little bit. So we know you agree that hormones are very important. I do too. Now, hormone replacement is a personal choice. Some women don't want to do that, and that's okay. But do you really think that once we get into menopause or once our hormones go low, replacing them at a biological level can counteract all that we see, not just on the outside, but also on the inside? But today we are talking about skin. So do you think that can actually counteract what you talked about?
So it's a piece of the puzzle, okay? Hormones, look, nobody has a magic wand. If we do, if one person gets it, trust me, everybody will get it, okay? So life leads to death no matter what we do. And the reason is that life is an inflammatory event. Inflammation is the cause of all disease and aging. Why do I use non-toxic skin products and try to cure people's skin symptoms non-toxically? Is because if inflammation is the cause of all disease and aging, okay, internal and external, then I don't want to give patients as a solution something that's increasing the inflammation, that's aging them more than life and stress and pollution are, okay? So, yes, hormones are an essential piece of the puzzle. They're not the only piece. You've got to use skin products that are maximal strength. In other words, that I don't say to you, oh, I see the result. You see the result. Your loved ones who surround you, your friends who haven't seen you in a while, they see that you look younger, better, meaning your skin is lifted. And there's certain skin products that are essential to force the skin metabolically to run the marathon. In other words, you want the skin making new collagen, new skin components, new immune system, new blood supply as youthfully as possible. Hormones bring that to the table. Supplementation. I'm huge on supplementation, and there's a reason for it. I don't care how healthfully people eat. They can't eat enough in today's world to bring them the level of nutrition that the body requires to maintain the rate of functioning, whether it be brain, physical. Look, the more people exercise, they need more nutrients. They don't have time to eat everything that they need to eat. And yes, green powder, collagen powders, all those things help, but there's a lot of different things you have to do in order to slow down the clock as maximally as possible, okay? And slowing down the clock is the essence. So skin products. So you eat food as your medicine. Exercise is essential, particularly resistance for your bones, because that's going to keep your skin plumped up, okay? Because that's what's supporting the skin. I'm a huge fan of microcurrent, which really came from La Belle France, okay? Could have been Germany, but I think it was France originally that microcurrent. And microcurrent, look, sometimes you'll hear people say that microcurrent does something for the skin. It does nothing for the skin except the skin is attached to the muscles. The muscles are underneath the skin on the skull. So if you have microcurrent, which is like weightlifting the face and neck muscles, okay, so it plumps up those muscles. But if your testosterone's low and your DHEA is low, it's not going to plump it up as much as if you were replacing your hormones if needed, okay? Again, some people make DHEA and testosterone hormones for a lot longer than other people. So you have to look at their levels with either blood test, or there's a really good test called the Dutch test, which sort of looks at all of it, but it doesn't look at everything. So Sometimes I'll do one, sometimes I'll do the other. But microcurrent is the skin is attached to the muscles. You're plumping up the muscles. You're lifting the muscles like you've weight lifted them. And so the skin's attached. So it lifts and tightens. And over time, the muscles, which gravity is working on to pull your skin to the ground, okay, microcurrent it helps weight lift the muscles, make the muscles stronger and plumper. So then the skin lifts and tightens. Skin products, microcurrent, supplementation is essential. There's certain things. Look, we use vitamin C, high doses on the outside and on the inside, okay? Because the skin, vitamin C helps force new collagen production. And then there's technology that really does help. There are that lifts and tightens more substantially, damages the skin in a healthy way that then forces the skin to make new collagen, to lift and tighten, help get rid of fine lines. You can do it for your eyelids, etc. The other thing that they found with eyelids is, look, the muscles of the eyelids get weak. So microcurrent helps that. There's some eye drops that they've discovered that you can do that help tighten the muscles some. But technology, tightening the skin, is very important in concert with all these other things. So you can do things one by one, but at the end of the day, it's better to have an action plan of first this, then that. But it starts with diet and exercise and trying not to be, as much as possible in today's world, try to be happy. Try to look at your blessings. Try to not be angry and depressed and the bad emotions, because it absolutely does aid you by depleting your adrenal glands. So being happy does matter along with everything else.
I agree. Now, again, there's a lot to unpack. What I wanted to ask you, going back to what you said earlier, you said you can put the same things on your face as you can put on your vagina. Are you talking about putting estrogen on your face? How do you feel about that?
So I use what's called Estriol, Estriol, which is a weaker estrogen of young women. The Brits discovered back in the 1960s that it was anti-cancer to a certain extent. I use that on the skin. People mix it in with my skin products, depending on your age. Really, once people get 48, 50, I'll have them using Estriol support. One pump, they mix it with their skin product. You put it on your face, your eyelids, your neck, your hands, whatever's left over, and it helps plump up your skin. And then for those women who their hormones have gone downhill, some women get vaginal dryness, and it's just like the skin gets dry, the vagina is skin, okay? And so in some women, they get vaginal dryness, other women don't. What do you do to cure vaginal dryness? Which again, I've got people putting it on their skin, putting it in their vagina if they have vaginal dryness, is Estriol support, okay? Because it lubricates. And the other thing I do is there's a very healthy vaginal lubricant called Egyptian Magic. It's a pale skin product, but it's the best vaginal lubricant on the market. But you have to do Estriol in order to plump up to lubricate the vagina. Can you use estradiol? Yes, but a lot of women make estradiol for a year or a couple of years, or with some women who struggle more with their weight, have metabolic syndrome, they generally make more estradiol from their adrenals, their kidneys to a certain extent. So estriol is a better choice for plumping up the skin. But can you use estradiol? Yes. One of the reasons that I am, I'm a formulator because I'm about non-toxic as well. I've always been a formulator, but I use cream hormones, bioidentical, mimic nature dosing, cream hormones. But what I learned when I first, years and years ago, started doing hormones is most of the creams that hormones are suspended in are very toxic ingredient creams. So I also made a cream that the pharmacist suspend the hormones in. So you've got a non-toxic cream, because you don't want to be putting a toxic, which means inflammatory cream on the skin and in the vagina, because if inflammation is the cause of all disease and aging, I don't want to be using anything that's inflammatory. So there's a lot of ways to deliver hormones. I deliver them the way I deliver them because it's about mimicking nature, and it's about being able to use, for instance, I use Retin-A, tretinoin. I use vitamin A plus, which is equivalent to 0.5% Retin-A tretinoin. I've got people using that not only because it makes the skin, it lifts and tightens, it makes the skin work at a more youthful level, but also vitamin A in the body is well known to be anti-cancer, to help with that. So I'm always doing things that are accomplishing a lot of goals at the same time.
Dr. Hunter, you're giving me so much information. My mind is spinning, but I love it. But I wanted to ask you, so I know some women don't want to replace the hormones because they're afraid. And even though we know, you and I know there's nothing to be afraid of, but some people are afraid of it. Were they just to put the estradiol on their face? Would that, first of all, be something that is shown in their bloodstream? And secondly, would that be enough if they just put it on their face but not replace their hormones?
So let's start first and foremost about why are people afraid about hormones, okay? Remember in the 1970s, pharmaceuticals put out Premarin and Prempro, which were synthetic. They came from horse urine. They overdosed people, and they caused definitely proven medical issues that everybody wants to avoid. That's where it first started from, the fear. Because prior to that, in the 60s, there was a very famous doctor who really started the use of progesterone, Dr. John Lee, and he showed that progesterone was good for the bones, anti-osteoporosis, gave you, progesterone is nature's tranquilizer. It helps you sleep. Women who have night sweats have low progesterone, sometimes estriol or estradiol as well. But so it was in the 70s that all of that happened, that people got fearful. Now, if you replace hormones in mimic nature dosing, okay, all you're doing is slowing down and turning back the clock. There are women, look, part of what we're supposed to do as your physician is look at what's your family history of breast cancer, with men, prostate cancer. Okay, with men, look, men, I replace lots of testosterone, DHEA, and progesterone with men as well. Men, their progesterone gets low and they get very difficult to live with. Okay, so I've got patients who are putting a little progesterone on their husband or partner's skin to make them in a happier place. And also progesterone in men reduces the size of the prostate. Okay, so progesterone matters with men. DHEA, which comes out of the adrenal glands, which sit on top of the kidneys, DHEA is anti-stress, pro-immune system, anti-aging. Men and women need that. Testosterone with men. When you give men testosterone, you also have to watch how genetically their body metabolizes the hormones. Do they take it to estradiol, which will increase their prostate size? But there are things that you can give people that thwart that. It's just knowledge is power. You've got to know how your body metabolizes them. And then there's nothing to be afraid of. They're not going to cause cancer. Now, do you not give oral estrogens? No one should be on oral estrogen, okay? and that means estradiol. Progesterone, is it better given by cream on the surface of the skin? Yes, but it has to be a cream that absorbs. Their pills. Pills are not as bioidentical or mimic nature, but I use those sometimes. The people who are fearful have just not had it explained to them how their body works. Yes, there are people who medically, you have to do things that help prevent more any cancer, but their cancer risk is there more so generally if they don't replace their hormones, if they're not taking supplementation like curcumin, glutathione, vitamin C that helps reduce the risk of cancer, if they're not exercising, if they're not eating healthily overall, garlic, onions, all the things that help prevent. So if they're fearful, it's because they haven't had it explained to them correctly. They need somebody who is advising them, absolutely. But can you put just estriol on the skin? Yes. What you do is you do it 2-3 times a week at the most, okay? Because estrogen, progesterone are supposed to be in a ratio. And progesterone helps with anti-cancer, okay? So there's a reason I've got a low-dose progesterone, a low-dose estriol, because those things people can use and feel safe with using them, okay? And again, why I do things like we're doing today is to help people understand what the great leaders of the world have said is nothing to fear but fear itself, okay? And knowledge is power. If you know how to do things safely and correctly, you have less risk. But yes, estriol support, not estradiol. You cannot do estradiol without balancing it with progesterone.
Again, Dr. Hunter, this is so much incredible information. You have to promise to come back on this channel. I have so many questions for you. Will you come back?
I will look very forward to doing that. I try to spend lots of time helping educate the public worldwide because, look, I've got a practice in London. I've got vendors that I help and practice with in Zurich, in different places around the world. So I'm trying to participate with everybody, with all of us who need to work together to educate the public because, again, knowledge is power. And then they can go to their doctor and say, okay, what about this? Okay. And there's a lot of information on the internet that's wrong or incorrect, or it's not complete. In other words, you don't see the forest. They're just addressing one issue. And you always have to look at a person as a whole person and what their genetics are as well.
Yes, exactly. Now, I will link all of your information down below this video so people can reach out to you and ask you questions and make an appointment with you. But like I said, you have to promise to be back because I definitely want to continue this conversation.
I will look very forward to it. Thank you.
Thank you so much.